My name is Gesine Hansen and I'm head of the Department of Pediatrics at Hannover Medical School, and I'm specialized in Pediatric Pneumology, Allergology and Immunology. My research group is very interested in the very vulnerable phase of the beginning of life. At this phase, the immune system matures, and we are interested in the maturation of this immune system. We investigate the immune responses against pathogens or other environmental exposures, and we also investigate the long-term impact of these exposures on health and disease of the child. Within RESIST, we focus on respiratory tract infections, especially on severe infections with respiratory syncytial virus. RSV affects almost all children within the first 2 years of life. Mostly it goes along only with mild symptoms, but in 1 to 2% of children it really takes a very severe, sometimes lethal course of the disease. And together with the research group of Thomas Pietschmann and other collaboration partners in RESIST, we try to identify susceptibility factors that increase the severity of disease, and we try to identify biomarkers that help us to predict the severity of the disease. And in the long run, we try to translate our gained knowledge to develop a prediction tool to predict the severity of a disease for a child, so that we can protect these children who are at high risk for respiratory tract infections with RSV. Another interest of our research group is systemic infection of the premature baby or the newborn baby, the septicemia. This is a major cause of death at this early age, and we are trying to identify biomarkers that help us to diagnose the septicemia early on, so that we can treat it as fast as possible. And we try to identify immune modulators that help us to promote a beneficial immune maturation of the child that protects the child from these severe infections. RESIST is a wonderful cluster. It is in the center of the cluster is really the patient. We have many very well characterized patient cohorts, and we have many outstanding scientists from all different fields: clinical scientists, natural scientists, computational scientists, and all these scientists bring together the expertise to answer our questions for the patient. So I'm really optimistic that with this expertise we really make a difference for the patient, a difference for the infectious diseases. And I'm very happy and thrilled to be part of this cluster. I find the newborn and the young child or the child very fascinating. They have such a long perspective, and it is really very important to protect these children from the beginning on, and also to prime the health in the long run. So it really makes a difference what they experience in the first days, weeks, months of their life. And we know today that it really makes a difference for their also health fate in the long run. So I really love it to work with this very young and really nice patients. And I think it is very clear that this work makes sense. Germany has probably one of the best medical systems in the world, but still, also in Germany, infections are one of the leading causes of death, and infections are complications of all different kinds of chronic diseases, like autoimmune diseases. These patients need immunosuppression, cancer, transplants, implants. We have a growing population of seniors who are very susceptible to infections, and we have the premature babies that are very often strongly affected by infections and actually often die from septicemia. So infections also in Germany are absolute threatening. So it's extremely important to do very good, outstanding research in the field of infectious diseases, and so we need the most outstanding young scientists to support us.